Hello and welcome to yet another session of D2, powered by digital and driven by data, an initiative by Medicine Man and Doc here. And this evening, we are going to discuss on generic products by definition do not differentiate. Can beyond the pill models work for India? And we have Raja Reddy of Servin International, Raja MVSMA of Dr. Reddy's, and Shantaprasad Nagarmat of Abbott with us to share their experiences and insights. So before we go into the session, let me quickly introduce the panel members. Raja is a pharma and marketing sales leader with over 27 years of rich experience in building pharma brands across emerging markets. During his tenure at Dr. Reddy's, Raja has handled P&L roles in CIS markets in Australia. He was responsible for building multi-million-dollar brands across 3 channels: RX, OTC, and hospital and institutional business. He was instrumental in building doctor portals such as Medzant and Medinrich, working on Pill Plus initiatives in pain, CNS, and oncology segments. So we couldn't have got a better person to share his thoughts on whether Pill Plus initiatives will work in India. We also have Raja Reddy, the Director of Operations Sri Lanka at Servin International, with 26 years of experience in sales, marketing, medical, business capabilities, operational excellence, and business analytic teams. And finally, we have Shantaprasad Nagarmat, Commercial Director at Abbott. He has got vast experience in OTC, multi-specialty pharma, and patient service excellence. Shantaprasad held leadership roles across pharmaceuticals, vaccines, and consumer products. Some of the flagship brands he was involved in are Pediasure, Complan, Dufalac, Dufaston, Influac, Udiliv, Digene, Crimafen, and Brufen, all very well-known brands. So let's dive into an interesting time of discussion with the panel members. So let me quickly share the snapshot of the poll that we had done recently, so you can get an idea and I can set the context for the discussion today. So this was the question that was asked in the poll. Generic products by definition do not differentiate. Can beyond the pill models work in India? And the answers, 46% said what is beyond the pill, and another 25% wanted to know how to do beyond the pill. All those, as Salil says, they may have different names like CRM for beyond the pill, but definitely I think a lot of clarity is needed. So without much ado, let me go to the first question to Raja for this. So Raja, the respondents to the Medicine Man poll are quite clear in stating that they don't understand what beyond the pill means, and they aren't clear on how to execute it. Can you give us some tips or any good examples that you may have observed?
So in terms of pharma industry, we are now grappling with what is beyond the pill. I completely agree with the poll, what was mentioned here. Not everybody understands what beyond the pill, or commonly we call it as pill plus initiatives in our colloquial language. What does that mean? In fact, when we started 3-4 years back, even before COVID, one of our initiatives in Russia, where we are very strong in pain management, we were thinking, what is that beyond the pill we need to look at? Does it make any sense or not? That's where our thought process has started. And finally, we went back to the customer, understanding that is pill good enough for them to solve their health problem, or they require some additional help. So when we are talking about pill plus or the beyond the pill, it's a combination of a pill plus any additional help required for the patient in order to become healthy. So we always talked about saying that pill is good enough to make you healthy, or you can get rid of the disease or a problem or a symptom what you have. But today, post-COVID situation, if you are looking into it, most of the patients are looking at a kind of, say, overall health outcome rather than getting rid of something. They want to be healthy. So when we are talking about a pill plus initiative, which is a pill plus something else which you offer, can help him manage his disease better on his own, along with the doctor or along with a physiotherapist or whatever it is. Example I can give you is for a chronic back pain patient who's having a low back pain and he's been suffering for years together. Today, most of the time, what he does is whenever the pain reoccurs, probably he pops up a pill and he's good enough. But is that good enough is the fundamental question when we have gone back to the customers and asked. And when we have looked at customers saying that initially they were suffering once in 3 months, probably now they are suffering once in 15 days. Now, when we have gone back to the fundamental reason of why they are suffering, it can be because of their posture, what they are doing, the kind of work, what they are doing, or they are overweight, or it can be multiple things. Or a teacher, for example, has to stand throughout the day. It also can actually uh, cause more frequent back pains, or a policeman, for example, yeah, a traffic policeman, okay, there, or a person who has to lift weights in his professional career, or a driver who sits throughout the day. These are the examples which we've got and understood, saying that pill is not good enough. Probably we need to provide him a kind of a healthy lifestyle, either to reduce the weight or probably exercise regularly in order to come down on the pill burden what he's going to take. Now, the fundamental dilemma for the pharma industry is we sell pills and make profit. Now, the pill plus talks about saying that please reduce the pill intake and become healthy. Yeah. So it's a kind of a dilemma which talks about saying that by selling less number of pills, are we saying that we will make less number of profit? Not really. What can happen is when you're talking about pill plus initiatives, that's where we are looking at also monetizing these efforts. Can we really monetize to make them healthy? There will be people saying that if I want to be healthy, if I want to do a healthy lifestyle, and also use a pill plus healthy lifestyle. Maybe one of the best example what you have given is in the case of diabetes. Today, diabetes pill alone is not sufficient to control their H1B or the overall sugar levels. They have to maintain their lifestyle to become better. So at any given point of time, we have reached a situation saying that pill alone is not good enough to be healthy. Probably you can get rid of a symptom, but you will not be healthy. If pharmaceutical industry moves their thought process from, say, getting rid of a particular disease or a problem to making the patient healthy, probably that's where the beyond the pill initiatives people will start thinking about.
Great. That's a wonderful answer that you have given. I think you have highlighted two very significant points. One is that to understand what is beyond the pill, instead of sitting in your boardroom and wondering and doing some brainstorming, you have gone to the customer, the doctor, and the physician and asked him, what would it mean for you, a service that is beyond the pill? And also you have gone to the patients themselves and in fact created persona of patients, like the standing patient or the sitting patient or the weightlifting patient, or you can create so many such personas to personalize beyond the pill services that you can provide for them. So that's really wonderful. So Raja Reddy, the next question is to you. In a generic market like India, where products are rarely differentiated, a good option to create differentiated value and therefore loyalty for customers is beyond the pill services. Can you share your thoughts on how feasible or how difficult is this for pharma companies who considers, making their pills as their core competence?
Probably it would not just be for pharma companies, and it's nothing new for me. Theodore Levitt, one of Theodore Levitt marketing myopia almost 50 years ago, where he speaks about how the railroads have vanished because they have not focused on, or rather they thought that it was railroad was all about people moving in trains. So how do we improve the train service or security or a comfort in the train? Theodore Levitt said that it's about actually understanding the need of the customer is moving from point A to point B. It's not about choosing which train. Now, if you bring that perspective, it doesn't matter whether it's beyond the pill, with the pill, off the pill. What pharma companies like us need to understand is you're trying to provide a solution to your stakeholders who who are HCPs, patients, pharmacists, and of course the governments. So at each level, I need to understand how the environment is changing. The environment brought in digital, which makes it more transparent, easy to interact. And what I need to understand is digital provides a great opportunity. A lot of times people don't take medication because they may not be aware about the implications of not taking the medication. Or you can look at HCPs, they do not understand, although all the information is available on the net, but how can that be converted into knowledge? So if you map these journey points, you will understand where the pain points are, and that's where digital comes in easy. So it's not beyond the pill, but rather everything centered around to ensure that the solution which is available, which could be a pill, an injectable, or even a software, for example, that can be delivered to the end user, whoever the end user is in this blockchain, whether it's the government you're looking at, whether it's the patient, whether it's the doctor, or whether it is within the company. That's how I would see it. So take practical examples. If you're talking about, example, chronic venous disease, where it's more a lifestyle problem. How do you make the patients aware that these are the treatments available or this is the prognosis? How can you avoid it? And offering the solution. So that's why, for me, yes, Anup, you nailed it right. It's more the understanding level and the technicalities. But the truth was already there 50 years ago, thanks to Professor Theodore Levitt. So nothing new. It's just understanding your customer, mapping the pain points, and delivering the solution.
Great. That's a great example and an analogy of you have given of train companies that people are not going from point A to point B, but what was their experience when traveling from point A to point B. The added services could be the catering services or other comfort factors that are provided to the train passengers. And so also now Pharma has to think that it is, as Raja also mentioned, that it's the health outcomes that matter and not just getting rid of the disease with the pill, and especially when it comes to chronic conditions like diabetes or hypertension, where lifestyle is the major contributing factor to these disorders in the first place. He may require beyond the pill services to improve his lifestyle. And in pharma, I think we are used to measuring our success by the number of pills we have sold, but I think we need to discover new metrics that will help us to understand how satisfied are the patients who take our pills with the outcomes that these pills give them, or rather pill plus the other services. So Shanta, here's the next question to you. You come from working in a consumer business. How do you see these changes in healthcare landscape? Do you think pharma's business model needs refurbishing? By definition, beyond the pill focuses on health outcomes of the patients rather than the sales of the pills. Your thoughts, Shanta?
Thanks, Anup. Before I respond, I wanted to just qualify that yes, there is a consumer experience, but I've been fortunate to be for the last 4 or 5 years in pharma, and thankfully on therapies that have been strongly contesting for services. So this is slightly more qualified view from that perspective. But I take your questions in 2 parts. I think the part 1 is the changes in the healthcare landscape, and the second is hence what is the progressive revamp that pharma models need to make. It's not that they are not making it; it is happening, but maybe we could put some dimension to it. Now, changes in the healthcare landscape, one could talk about several things, but in this particular context of pill plus service, I think what is important is to look at 3 powerful trends where the pharma pill companies, would become a little myopic if they do not acknowledge these three trends. I think the first, trend is patient consumerism, as I call it. Consumers today, patients today are taking charge of their health. They want health to be demystified for themselves. And thankfully, it coupled with access to internet, access to information, it is almost making healthcare decisions more consumerized, whether we like it or not. So that's one important trend that's happening. And it's on the wall. You look at the content consumed on health or disease. You look at the patient communities out there on social media, the self-medication for therapies. I mean, it's out there. So there is increasing consumerization of these decisions that patients are making, and those decisions may not entirely happen inside the clinic. The second trend is around this concept of integrated health. While pharma always existed, I think what's springing around it is seeming like an ecosystem today, but there are a lot of healthcare services, starting from devices to health apps to almost marketplaces. Whoever thought that doctors would be rated on apps and patients would make their decisions? It was always a very credible word to mouth kind of a situation. But there are a lot of these players who are springing around, and almost if you take a step back, it looks like from literally education to compliance, there is almost an ecosystem. And it's not just medicines, but there is a parallel trail of other things which qualify for holistic treatment that's kind of coming together. And again, one needs to take a view of that. And finally, if we take a step back from the pharma industry, there is this growing barriers to allopathy one must acknowledge, which is alternate medicine. You just type in diabetes today. The first 4-5 links that will come up is, taking care of diabetes without medicines. So, there is Ayurveda, homeopathy that always existed. People are more and more embracing that. Now, unless the allopathy or this ecosystem acknowledges that we need to approach it with an holistic view, this would become irrelevant and restricted. I think those are the three trends, especially from a service point of view, that I'd like to highlight. Coming to your second, part of the question quickly, I really find the word health outcomes very powerful. Ultimately, that's what matters. And that's what we all exist for. And I think in the concept of health outcomes, do pharma pill companies understand? Of course, they understand that they play a small, or maybe they play an important role, but not the only role. And there are interdependent other factors that lead to health outcomes. So today, there is no choice. It is about identifying what is my right to win. You have to participate in that pill plus service concept, but then the right to win. And there I would just leave with, three very, very sharp, thoughts. One, if organizations really acknowledging this and willing to participate, I think, the painful learnings have been, what is the right to win for the organization? I would strongly solicit that if you're a leader brand, and if you're looking at it from a therapy expansion standpoint, I think then it makes choice. Second, what Raja mentioned, which was about once you've identified where to play, what are the pain points, what are the need gaps there? Is it diagnosis a problem? Is it treatment beyond pill a problem? Or is it compliance? What are we solving for? I think understanding our right to win is, I think, important. The second point is around creating the right capabilities. And I think I'm a very, very strong advocate of that. When we create an OTC division, we almost bring people from consumer background. I think it's time we acknowledge that maybe the strengths of pharma lie in a certain, and I consider myself pharma, so please do not, I'm not trying to, I'm not trying to segregate myself here. But I think we've all realized that services is a very different ballgame. And I think the investment, the right commitment, and a roadmap for services and creating a service organization will lead to success. And lastly, strong advocacy for pharma, coming from a pharma background that we are trying to solve for is treat a service almost like a product. Think about where is the gap to doctor adoption? How are the consumers experiencing the services? Because if the services and the pills go hand in hand, the health outcomes become even more important. And over a period of time, rather than worrying about ROI on the business, can we start monetizing these services if they are good, in certain ways, to at least take care of the costs of the services that we are offering? I think there is a way for, some of these services to exist. So those are my thoughts.
Great, thank you. That's really nice to hear from you. Yeah, I fully agree with you that the patient consumerism is on the increase, and doctor at times might be at the receiving end from what I am seeing on the comments on Twitter by doctors. When patients rate them and some of them give good comments, the doctors are happy to share with them, and they're equally upset when there is a negative comment. So, we can't stop technology from progressing, and this technology, as you said, rightly, is demystifying healthcare, and the patient and the person wants to know what am I going through, and what are the outcomes for me going to be. So that's the first mega trend, if I should so say. You mentioned about the changing landscape in healthcare, and rightly, as you pointed out, there is an ecosystem emerging now, and this ecosystem consists of various service providers beyond the pill. And that's very important to understand this ecosystem, and what role am I playing in the ecosystem, and with whom do I need to partner in the ecosystem to be able to better serve my customers. And also a very, very, very important point that you said about, there's a growing resistance or kind of a pushback from people to modern medicine. They find Ayurveda more attractive, and there is no more greater proof that today itself in the morning I posted that how Apollo Hospitals has taken over Ayurveda, which is a Ayurvedic or a wellness chain of clinics. So this is something that they want to offer as a package, leaving the selection to the patient as to what proportion of treatment he would want from which stream of medicine. So these are the concerns that one needs to keep in mind, changing trends while trying to go beyond the pill. And very importantly, you want some significant points like, what is my right to win? So I must have a clear understanding of what we are solving or what we are creating, and more importantly, what are our capabilities. And so if we don't have certain capabilities, how and what do we need to do to develop them? And lastly, you said, treat service like a product, and somewhere down the line, you should look at monetizing these services, and therefore derive value from these services that are offered to the patients. So great. Next question to you, Raja. What are your thoughts on the healthcare continuum moving beyond physicians alone? How is pharma dealing with this development? Are we involving patients, their families, caregivers, etc., or should we do more of it?
So when I look at this question, one thing which comes to my mind is we pharma companies ourselves are stuck in this making a quick buck. When we are talking about pill plus initiative in particular, we are talking about change in behavior, and it doesn't happen overnight. Somebody who had got diabetes, today we are in the world of 3Gs, 4Gs, and 5Gs. Everything should be instant. A result should happen in the next second. That's what patients look, families look, caregivers look. But if I take a typical example of a diabetic patient, it's not a journey that he takes a pill and diabetes vanishes. So that means he needs to actually get a behavior change in his lifestyle, the method of his living, and not only he himself, at the same time, the caregiver, the family, everybody should support this. Yeah. And this entire behavior is going to take time. That means whichever pill plus initiative as a pharma company we take, we talk about monetization on day one. It really doesn't happen on day one as a monetization. It's going to take years. And this is a journey every pharma company should understand before venturing into pill plus, because today most of the brand managers I talk to, pill plus has become a fad. If they don't talk about pill plus or beyond pill initiative, they feel that they are out of place. That's what they think. But one thing we need to keep in mind is it's a behavior change, not for patient alone, but to the entire family or the caregiver, and it's going to happen over a period of time. And probably monetization happens also at a later date. It's like you're talking about a habit change, which doesn't happen overnight for you. And the second question is, now, should we go back to patients or focus on doctors alone as we pharma companies? Now, we are tied up with doctors for life is what we think. But today, with the pill plus opportunities or with advent of COVID, what Shanta Prasad had told, that now patients are taking their health into their hands. There's so much of information available on the net. So it becomes inadvertent that we need to go back to the patients, understand their customer needs. What is that they are looking for? Is it just a pill or an overall health outcome? That kind of an understanding a pharma company should have. And ultimately, we as pharma companies, unless it's an OTC product or a consumerized product, we can't go and directly talk to the patient. But at the same time, we also need to go and talk to the doctors. Doctors become a kind of a mediator between patient and a pharma company to make this entire behavior change happen. Today, most of the patients, even if you advertise directly to the patient and talk about, there are so many apps which have come in the area of diabetes or hypertension, which they're advertising, people do not believe. So they require somebody who is going to endorse and tell the patient saying that it's going to help. It's a behavior change which you need to do. So doctor still become an important part of this entire chain, and we can't do away with completely. What I'm saying is, by bringing in consumerism or going back to the customer directly, we cannot remove the importance of the doctor in the entire chain. Doctor is an important point, but at the same time, what happens is, by understanding the learnings of the customer, taking back as those learnings into your product development, whether it is a digital product development or a therapeutic, say, DTX product, what you're going to develop, doctor, you go back to the doctor and ensure that the patient follows that for the health outcomes, what it is. That's where it looks like it's going to be an arduous journey for pharma companies. It's not going to be that easy because we are talking about changing behaviors of billions of patients.
Great, that's true, that it comes to changing the behavior, and therefore one has to look not just at the patient, but also who might be useful in influencing him in changing the behavior. I remember many years back when Marico launched Saffola as a heart-friendly oil, they started with the kitchen because the person responsible for choosing an oil was the lady of the house, and therefore the ads were targeted at the women in the house. So I think pharma has to think beyond the patient as to who are the other people who might be influencing the patient. And also, you very rightly pointed out that while the doctor will remain at the center, just as the medical rep continues to remain at the center, but how do we bring in other players, and how do we actually help the doctor to better manage his patient? Because this patient of chronic disease could remain with him for 5 years, 10 years, and therefore patient satisfaction becomes all the more important for doctors to make their patients happier, if I can say so. So Raja Reddy, here's the next question to you. Rebuilding public trust in the work that pharma does is very important for the industry. I think during the COVID, this was at an all-time high. I mean, pharma really gained a lot of trust and appreciation because the way in which they quickly rolled out vaccines. So rebuilding trust is very important. Will this be possible by making better pills alone, or should pharma use beyond the pill to achieve this task of rebuilding trust in the pharma industry?
Anup, we are speaking about the pill. Of course, we are pill-centric companies. But the fundamental difference is how internal stakeholders understand. I don't think pharma companies are pill-centric companies. We are using the pill to sell a solution to our stakeholders. Okay, so that's the first understanding. So if we understand that today the pill is there, tomorrow something else would be there. But yes, I think digital gives a lot of opportunity to pharma companies because Raja from Reddy's has explained a very fundamental thing. We are regulated in a way you can't approach the end customer. So what happens now is the end customers are reaching out to us, of course, through doctors, through chemists, through governments. So we have platforms where we can engage with them through our stakeholders, or help our stakeholders reach them in a meaningful way. So that's going to improve trust. Take, for example, in a medication, where when patient comes back to the doctor who has prescribed, says that it didn't work, the doctor can use any of the technology means to find out or help him whether did he adhere to the treatment actually. So if he can help him adhere to the treatment, stick to the diet, help him do a bit of exercise, in my opinion, that's going to be beneficial to all of us. Or second, in a country like India, where we have a lot of quality of the medicine always is a question mark. Now, using digital means, if companies can provide end-to-end transparency, the patient is going to be very happy. So at the end of the day, it's the trust we will gain, not only from patients, but from all our stakeholders, be it pharmacists, be it governments. Once again, Raja spoke about outcomes. Governments are looking at outcomes rather than purchasing pills. If it's the reduction in HbA1c levels, can the pricing center around outcomes? It's possible now. So we can collaborate with them. So yes, at the end of the day, I think there is a strong possibility for pharma companies to leverage digital, because it cuts down so many layers for us to reach out to our end customers, all of them, all stakeholders. It's a great opportunity. It's going to be better. It's not going to be worse for pharma companies. In fact, things are going to be better because we're going to improve adherence rate. We're going to improve engagement rates. We are going to improve understanding of the stakeholders around our pricing problems. All that could be possible.
Great. That's a good point that you made, that pharma has been going beyond the pill, because the pill is offered to solve certain problems that the patient faces. And now with the changing scenario, with the emergence of a health ecosystem, there are many other things that the pharma companies can do, although this is not going to be easy because of certain mindsets. But then the digital really opens up new avenues, because every consumer or every patient is on one or the other social media or on the internet, and it is so easy to put out those information, maybe in partnership with some other credible agencies, which therefore the doctor can direct the patient or patient himself can access. So wonderful points there, Raja. Thank you very much. Shanta, the final question is to you. Healthcare is expanding to health, which you already just mentioned, which means that the inclusion of prevention and not just focusing on cure or care. Doesn't this require pharma to redefine its customers? Shouldn't we think beyond patient centricity and include people centricity, include the well and not just the sick people? Your thoughts, Shanta?
Yeah, this is a very thought-provoking question, and it's definitely beyond pill plus service. To your question on whether pharma needs to redefine its customers, I'm almost saying that maybe pharma organizations need to take a pit stop and look at its overall strategic mix. But before I come to that, I think in pharma we've always acknowledged both patients, HCPs as our primary stakeholders. So I don't think there has been lack of education or lack of need for getting the patients on board. But what's also happening is the relationship and the dynamics around are ever evolving. And I think in that context, I meant that it's not just the customers. I don't think customers really need to be redefined. But what is important is, do we take a pit stop and take a measure of where are we today? Where do we really want to go? And where does preventive and wellness come in the context of our business? One of the things that I've learned over the years is, I think there is what is very important is, what is your right to win? Because you may create something and that may be of an advantage to someone else. So, that's really important. So in the context of reviewing, your strategy, I would perhaps look at preventive and wellness really from 4 dimensions as top of mind. One is, I think it's important to evaluate what is the current portfolio. So if one is looking at the preventive and wellness space, I think what is important is what do we want to solve for and who are our consumers? And I think in that context, I would look at about these 4 aspects. One, I would look at what is our right to win? What is our current portfolio? And what are the spaces for potential adjacencies as a product solution that we could look at? Well, imagine if we were a vaccines, if it's a vaccines organization, they operate in the preventive space. So the dynamics are very, very different versus if it's a pharma operating in curative space, there are adjacencies that may come in. For example, if you're in an ortho space, a vitamin D may be a natural adjacency for, one to add. If you're in the GI space, probiotics are gaining, there's incredible science that's coming around probiotics. So versus the current portfolio, what are some of the adjacencies, that one needs to look at to strengthen the portfolio? The second choice is about what is the model. If the model is fundamentally, if the new products launched will still be directed through the RX, and it does make sense. We've thought about vitamin D so often. We've thought about probiotics so often. We've thought about a lot of nutrition supplements for expecting mothers so often. And the doctor's validation is an important stage gate for them to take some of these products, especially if they're dealing with a condition. So the second point that is important is if I need to drive education around some of these products which are new, and what are the GTM capabilities that I need to build? Because the doctor is only going to say so much about the product. So the second choice to be made is if the one is about the product. Second is if the product is going to be still delivered through the doctor route, then there may be education assets that need to be created, almost anticipate what kind of questions consumers may have. Then GTM capabilities within the current ecosystem or something new to be able to make this available to the consumers. I think that's the second point. When one thinks about preventive space, there is also scope for services, which is our topic for today. And sometimes the products may still be in preventive, but the services could be, the products could still be in curative. The services may still be in preventive space. And identification of such services, there could be lifestyle modification. There could be about mental health. Even with consumers look at in constipation, we've seen in acidity, we've seen that invariably consumers deal with so many tips that they get, but can we give them expert ways of dealing with things? So that could be a third element to playing in the preventive and the wellness space to add the overall credibility to what we do. And finally, I think the fourth and the most important one is for a certain acute therapies, it is important where the self-medication is high, where RX is tapering down, but the category continues to grow. I think it's time to acknowledge that we may need a separate organization from an OTC standpoint to be able to cater to that kind of a demand. So product, services, education and GTM and OTC, those are my 4 bets on health and wellness space.
Great, that's wonderful insights from you, Shanta, that we need to see what is our current portfolio and what adjacent portfolios or product ranges that we can add that will be beneficial to the patients whom we are already serving. And is it going to be only RX or should we add DTX or OTC, as you said, and what is our go-to-market capabilities? We should be clear on that. And finally, a very important point that products can be curative and services can be preventive. That's an excellent combination that pharma needs to understand. And acute therapies, yeah. So whenever anybody gets a pain or a fever, I think the local chemist is the first point of contact. So when you talk about education, it may not be just educating the patient, but even educating the pharma community so that they actually become something like community pharmacists. And people have an excellent rapport with them, trust with them. And these are all challenges, how we can address and go beyond the pill. So thank you very much, gentlemen. I really appreciate you're taking time. I know you're all very busy, gentlemen, but this will be much appreciated, because when insights and experiences are shared by practicing professionals, the trust factor is very high in what you share. So thank you very much once again, and have a great evening.